Hello, everyone, and welcome to today's episode of Medical News Updates. I'm your host, and today we're talking about a common type of medication called beta blockers and how they are used after heart attacks, specifically in patients with a strong heart pump function. Heart attacks can be scary and life changing, but thanks to modern medicine, there are treatments that help people recover and prevent future problems. One of these treatments involves medications called beta blockers. These drugs have been used for many years to help the heart work better after an attack. But researchers are always working to understand just how useful these medications are for everyone who has had a heart attack. Recently, a large study was done to see if beta blockers help people who had a heart attack but whose hearts are still pumping well. This study was really thorough, involving thousands of patients, and it provided some interesting results. Now let's look at some of the key findings of the study. The study looked at people who had a heart attack but did not have their heart's pumping ability weakened, which doctors call having a preserved ejection fraction. Participants were either given beta blockers or not, and then doctors watched to see how they did over several years. Interestingly, the study found that there was no significant difference in the health outcomes between those who took beta blockers and those who did not. This includes the risks of dying from any cause or having another heart attack. What does this mean for patients? Well, it suggests that if someone has a heart attack but their heart still pumps well, beta blockers might not be necessary. However, one study might not change our established approach to using beta blockers in patients with normal heart function after heart attack. Clinical practices might indeed shift if further trials similarly demonstrate no advantage for this group of patients. But before we wrap up, it's important to remember that everyone is different. If you or someone you know has had a heart attack, it's crucial to talk to a doctor about the best treatment plan. What works for one person might not work for another. That's all for this episode on Medical News Updates. Thank you for tuning in. If you liked today's episode, don't forget to like and subscribe to our channel. Feel free to drop a comment with your thoughts or any questions you might have. We love hearing from you, and it helps us make sure we're covering the topics you care about most. Stay tuned for more updates. Until next time, goodbye from all of us here at Medical News Updates.